So our project is Puberphonia. Everything in this handout will entail basic information needed after a puberphonia diagnosis. This handout was created by myself, Abigail Shaver, Sabrina Smith, Sophie Wedding, Miranda Watkins, and Emily Sweet. So to begin, what is puberphonia? Puberphonia is a voice disorder that is identified by a high-pitched voice. It is often called functional falsetto or mutational falsetto. It is commonly identified after puberty when that childlike or high-pitched voice persists, and it also is with no abnormalities or damages to the larynx. So I'm going to go ahead and pass it on to Sabrina to discuss prevalence.
Okay, for the prevalence of puberphonia, puberphonia is commonly seen in males who continue to exhibit a higher pitched voice after puberty. The incidence of puberphonia in the general population is about 1 in 900,000. While this condition predominantly affects males, it can also occur in females in very rare cases.
Hi, if you've recently been diagnosed with puberphonia, you might have some questions about what it is and why it happens. In this video, I'll explain factors that contribute to developing puberphonia and help you understand what's going on with your voice. So why does it happen? There are a few reasons why this might happen, and they often work together. Tight throat muscles. The larynx sits too high in the throat, keeping the vocal cords tense and preventing a deeper sound. This muscle tension can make it difficult for the voice to naturally lower in pitch. Mind-body connection. Stress, anxiety, or even discomfort with a deeper voice can keep the pitch high. In some cases, a person might unconsciously resist the voice change due to personal or emotional factors. Speaking habits. If someone has used a high-pitched voice for years, it can become an automatic habit. Over time, the brain and muscles reinforce this pattern, making it harder to shift to a deeper voice naturally. Brain and voice mismatch. Even though the voice box has physically matured, the brain might still be sending signals to produce a higher pitch. This mismatch between the brain signals and vocal function can make it difficult for the voice to lower on its own. The good news is that puberphonia is treatable.
Hi, so I'm going to be talking about the common vocal signs and symptoms that are associated with puberphonia, and they include the following: hoarseness and breathiness. And these two qualities often make an individual with puberphonia's voice sound unusually high-pitched, with occasional sudden drops in pitch or barely audible sound due to low air pressure. This causes their voice to take on an adolescent or immature vocal quality, similar to a teen boy going through puberty after having passed this age.
There are many treatment options for puberphonia. Treatment plans will start with non-surgical practices such as voice therapy. A speech therapist will teach you to strengthen your vocal cords and change your pitch by using new techniques. It is best to attend mental health therapy in tandem with vocal therapy. The mental health therapist can help assist you in breaking down emotional barriers and building confidence. In some cases, medical interventions such as Botox injections might be recommended to adjust pitch. If non-surgical options have not been successful, there are surgical treatments such as thyroplasty, which is a procedure to adjust the position of your vocal cords, and type 3 phonosurgery, which reduces the tension of vocal cords. Laryngeal framework surgery is another option to modify the structure of the larynx to improve vocal quality.